Okay, good evening. I'm Dr. Rajkumar from Coimbatore. I'm the Secretary of Indian Arthroplasty Association now, and I'm also the Senior Arthroplasty Surgeon who do hips and knees surgeries in Coimbatore in Ganga Hospital. So, in this meeting, we all gathered together to discuss about the latest developments in joint replacement surgery. That is the main agenda of this whole meeting, scientific meeting. But apart from that, we are very much inclined towards training young surgeons. That is where the future is going to lie. So all young surgeons who are all passed out of their training programs, they need a specialization. So for that specialization, they need a hands-on training in specific centers. So for that, we conducted a fellowship interview where the Indian Arthroplasty Association will give sufficient period of like 4 weeks to 6 weeks in specific centers where these fellows will go there and get trained, and for that some amount of remuneration will be provided from Indian Arthroplasty Association as a grant, so that these fellows from the tier 2 cities who don't have get that opportunities to go to higher centers, that is where IAA, Indian Arthroplasty Association, plays a role in facilitating them. So in that way, tier 2, tier 3 city surgeons get opportunities. So that is our one agenda. And the next one is we also encourage a lot of research activities. So future we need a lot of young surgeons to do a lot of research. That is where innovation comes. That is where a lot of new ideas come. So that we are encouraging the youngsters. So that was discussed in these meetings. And also these meetings we make sure that a lot of surgeons, young surgeons, come and meet senior surgeons, and they get to interact, and then they see all good points out of this. So it helps the young surgeons future, they shape it very nicely, so that they not only become a good surgeon, they also become a good clinician. So at the end, all these things transform into a good outcome. So the patient is the one who gets benefited out of all this. So the whole effort is for the betterment of the patient. So in that way, I can put it across. At the end, it is the patient. Good health care is provided, and because of that, the public gets benefited. So that is the whole idea.
And what are the criteria for the fellowship?
So attend the fellowship, first of all, there should be the surgeon should be a life member of the Indian Arthroplasty Association, and he should be already a practicing surgeon. This fellowship is mainly to fine tune his skills. So he has to be already a practicing surgeon, member of IAA, Indian Arthroplasty Association. He should have done some basic research work. With all these things, he has to attend the interview, and in the interview he'll be questioned not only in regards to the subject, he will also be questioned in regards to his thoughts and future plans. So based on everything, we will select whether he is ready to go to that particular center.
Like how has the IAA changed in the past 20
Oh,
years?
it's a huge change. In the 20 years back, the generation era was totally different. That time there was no phones, no mobile phone, no Google, nothing. So, but that time our seniors really set the ball rolling by bringing this association, starting it. But slowly, at every 10 years, you need some change. Change is inevitable in everything. So like that IAA in fact guided us, helped us in training young surgeons. Even when I finished out my basic training, we were not having this kind of opportunities. We never had the opportunity to go and do these kind of meetings, attend these meetings. But now these meetings are happening everywhere, and because of that, youngsters are getting benefited. So in the last 20 years, there was no website for anybody to know anything. But now we have created a website. Now we have created an online payment. Anybody who wants to become a member in their mobile phone, they can do it.
And also yesterday we heard that live webinar was going during this COVID time.
Yeah. We have not done last 4 years, 46 webinars. Every month we are doing constantly one webinar. So that is also helping everybody sitting at their home in the night in their bedroom, they can learn through the webinars. And in that webinar, all the faculty is from across the globe. So that in fact we have to thank pandemic COVID, because one way COVID was bad, but still that has created these kind of these kind of avenues and opportunities. So that way, that is also good. Now Indian Arthroplasty Association is in the right direction. Not only in the right direction, it is in the peak, going into the right. It is actually peaking so much. So we are happy that it is going in the right direction. Now we are grooming youngsters to take up a lot of good positions. So in that way, we are ready to pass on the baton to the younger generation.
Like, what are the key attractions of this conference which you like the most?
The key attraction here is the life surgeries, first point. Second point is lot of faculties have traveled across the globe to come here. So this is easy. It is not easy to interact with so many faculty. So this is a good place to interact with them. Everybody learns from one another. So these are the two main things out of this. And of course, the hospitality is good. Nice place, nice weather.
Thank you so much for your time.